Hello, this is Robbie Bennett, and um, I'll let you introduce yourself in a second, since we're going
Yeah.
to do our intros to this. But this is the first episode of the FAIR, the Future of AI Research podcast, here at Wake Forest and School of Medicine. Just a quick overview of kind of like what this is, what you can expect. Um, Hoping to do this every couple of weeks just to talk about a relevant topic that's happening, answer any questions you guys might have, and then talk about some things that we're kind of interested in and just see how this goes. Pretty open form. Like I said, I'm Robbie Bennett. I'm the president of FAIR. Um, my research is in using AI to detect biomarkers of resilience to aging. So I do a lot of machine learning, a lot of deep learning stuff, and I've had a history of working with deep learning models and machine learning in different bioinformatics capacities. So I've always been interested in AI and wanted to do some kind of education around it. And since there's not a ton in the School of Medicine, especially in just like clinical AI fields, thought this was a good idea. And Fahim was down. So, Fahim, if you want to introduce yourself real quick.
Yeah. So, hi, everyone. My name is Fahim. I'm a fourth or fifth year. I always lose track. Basically, my last year of the PhD program in biomedical engineering. My research, if I was to give like the title, it's basically artificial intelligence and advanced modeling techniques for optimizing our resuscitation strategies and hemorrhagic shock. So, it's a whole bunch of words that basically says that we work with massive blood loss. We use AI algorithms to really try to track what or predict what was the level of blood loss in a patient. And then from there, I create models to really understand patient progression to help guide clinicians to make better, more data driven decisions when they deal with patients who are in varying levels of hemorrhage. So I work heavily in the AI stuff as well, but from a very different kind of perspective than what Robbie does. So it's kind of a nice way to have two people who work in the same field, but completely different kind of modalities of AI to kind of come together and butt our heads and try to figure out what's similar, what's different. Do we look at problems the same way? And hopefully it benefits everyone who's listening, whether you're a clinician or just average person.
Yeah, especially since in the School of Medicine, most of the AI stuff you see is like image analysis and image segmentation, stuff like that. And I feel like there's a lot of exposure to that, especially in the clinical side of the School of Medicine, where you're talking about a lot about radiology and
Yeah.
like all these different types of imaging methods, CT scans, MRIs, et cetera, et cetera. There's a lot of ways to process that, but there's not a ton of people, at least talking about the other methods of
Mhm.
bioinformatics or biomedical informatics and stuff like that. So,
Yeah.
not that we aren't going to be getting into some of that we're
Yeah.
not going to have guest speakers on to talk about that, but there's a massive wealth of information out there about AI, and
Yeah.
there's just like everything, it's hard to keep up with all of it.
Yeah. And just to add on to that, like I'm doing a pet project, which I hope to turn into a postdoc, dealing with the image kind of stuff. And it feels like I'm like relearning how to ride a bike because even though it's the same kind of algorithms we're using, very, very different application. It shows you how big and vast this field is, where you may be using the same tools and same toys, but still very, very different way of thinking. So hopefully we'll give a lot of, background into that for people to kind of learn, play around with AI, and get a good understanding of how it actually works. It's not here to take over the world yet. Maybe one day, but we'll teach you how it works. So when it does take over the world, you can at least talk to the AI and be friends with it.
Yeah, I mean, the big thing about this is that we want to demystify a lot of things because
Yeah.
there's so much out there. Just like with a lot of health science, I'm sure plenty of us have seen TikToks and reels about people being like, I don't know what to believe when it comes to health anymore because I can look up whether coffee is good for you, whether it's bad for you, and I have things to say both. And we want to help with that AI literacy. So when you're approaching something and you hear words like large language model or transformers or autoencoders or things like this, you have a better understanding of what they are and kind of what they're used for, and not so much like this is just something that's going to take my job away. Because I
Right.
don't think that's anyone, that's not most people's intentions.
Right. And I think that's a good segue for us to kind of give some introduction to some of the concepts behind AI. Like, what is AI? What is these terms like machine learning or deep learning or autoencoders? So maybe we can start talking about some of that first.
Yeah, for sure. The big thing is that everything gets labeled as AI, and that's because AI is the umbrella term for a lot of things,
Mhm.
and uh, it's kind of misleading because people just kind of equate AI with like ChatGPT and stuff like that at this point,
Yeah.
but it actually breaks down into other umbrellas that then further break down. So, like the two main groups of AI are like machine learning, traditional statistical machine learning. If you've heard about clustering, if you heard about regression, if you heard about like PCA, principal component analysis, this kind of dimension reduction, a lot of those are machine learning because they're more statistical methods than anything. Um, on the other side of things, there's deep learning, and that's where you start getting into neural networks and stuff like that because you'll have things like neural networks, obviously, deep neural networks that have multiple layers. I think the cutoff for deep learning is that it's 3 layers because anything below that, you start getting closer to regression than you do like an actual deep learning model. Uh, and then you have things that have neural networks attached to them, basically. So you're looking at convolutional neural networks, which is a model that's used to process images. Uh,
Mhm.
like we mentioned earlier, there's a lot of image analysis, and CNNs is the acronym for it. They are designed to go through and look at sections basically. But at the
Mhm.
end of that model structure, there is a neural network that will kind of process the inputs that are fed into it from all the convolution layers.
Right.
And it gets
That's
really complicated because there's like a lot of steps to get to that neural network, but the fundamental aspect is that they all have neural networks
right.
attached to them.
One thing I like to use to kind of make it simpler for people to kind of get the concept, like if you wanted to use a machine learning model for like classifying something, you can't give it like a picture of like a monkey. You can't give it like a pressure waveform. But what you do is you kind of give tidbits of information. So instead of giving the picture of monkey, you say like this guy is like 4 inches tall, or his skin, his fur color is brown, stuff like that. You give these small pieces of info. It tries to look for the patterns and really classifies based on that. Deep learning models, on the other hand, you can actually give that raw picture. You can give like a whole like kind of waveform of like continuous data, and it tries to learn patterns in the image or in the data that you're giving him, and then tries to make those classifications based on that. There's a funny picture I always like show when I'm explaining this in my committee meetings to my committee, and like it's just like this little like picture of like a monkey next to an elephant, and it goes through this exact process I told you, and it's just like, oh, I get the height of the monkey, and then I get his tail, I get all that stuff. And then machine learning will just take that piece of data and then be like, okay, this is most likely a monkey. Whereas deep learning, just give the image, and you train the model of like thousands to hundreds of thousands of pictures of monkey versus an elephant, and then you give it a new picture. It's like, okay, well, I've learned enough about the picture of a monkey, and I've learned enough about picture of elephant to know the difference between the two. That's kind of like the way I like to make it simple in my head.
Yeah, and even outside of that, because in deep learning, there's been this huge sector that has kind of revolutionized this area that's led to large language models and things like that,
Mm,
which large language models aren't just like a neural network where it's just a defined model, this is what it is.
mm,
Large language models are it's kind of in the name. They're these huge models that are made up of all these different parts. Some of them have machine learning aspects built into them. So they'll do regression tasks that are then fed into a deep learning model, which will then process that further.
mm,
So you get into this really interesting world and the deep learning side, but like some of that is recurrent neural networks where you're looking at data over time. So it's not much you're looking at images, but you have this deep learning model that's looking at all of this information at multiple time points longitudinally and then making decisions from there, some kind of characterization. So you can think
yeah,
of it as like trying to predict the weather or something like that. They're used a
yeah.
lot in natural language processing to tell for sentiment analysis, to tell if
Mm-hmm.
something is negative or positive.
Hmm.
So like deep learning gets into really uh, unique use cases that are kind of outside a lot of the means of machine learning, whereas machine learning is typically more so for like data science things, honestly.
Hmm.
Like these statistical methods. There's some that
Hmm.
kind of go outside of that. Uh, there's been a lot of work because people are returning to machine learning because a lot of people are realizing most of the time you just need linear regression.
Yeah, very, very,
Sometimes it's just that simple.
yeah.
Uh,
In my
but
own
yeah,
work, I
it's
used, oh, sorry, not to cut you off.
go
Oh,
for
I
it.
got to say, like in my own work, I face this problem a lot because people very. It seems like there's almost like a school of thought that you make everything deep learning because deep learning is such an amazing thing. Then there's another school of thought where you're trying to make a machine learning model basically catch up with a deep learning model in accuracy. Because with machine learning model, because they're so simple compared to deep learning, there's interpretability. You can actually like, understand what the machine learning model is looking at. What are the most important pieces of data to machine learning model? Whereas deep learning model will just be like, oh, I looked at this random corner in this picture that you gave me. It means nothing to the average human being, but for some reason the computer really wants to learn it. And it may be very predictive, but you're not going to look at that real life. But machine learning models, you can actually kind of create a striation. So, like if you're looking at patients, for example, if you use patient data, let's just say, for example, heart rate is much more important than arterial pressure. Like let's just say it's like 75% more important. So a physician would prioritize getting that information to really understand what is the patient condition because of its importance. Machine learning model will tell you that information. Deep learning model will be like, oh yeah, I looked at something completely altogether, averaged them together, multiplied by 20, and then came to this weird number. It's very uninterpretable. So that's one of the
Yeah.
benefits of what Robbie's saying, exactly.
Yeah, and there's uh, so the way that my PI is kind of defined it in my head in a lot of
Mm-hmm.
our conversations is that machine learning models essentially in the end give you an equation that you can then use to
Mm,
evaluate the features and their importance. So whether
yeah.
it's like blood pressure or temperature or weight or whatever, it will tell
Mm-hmm.
you how much each of those are important. It's easy to calculate. They're extremely lightweight, extremely fast.
Mm-hmm.
There's some newer machine learning models that take a lot more resources, but it's nowhere near what deep learning takes. And you can still get some of the feature importance from deep learning, but it's a lot more kind of guesswork than
Mm-hmm.
it is, and sometimes it takes a lot more resources and time to get than it does in machine learning. So uh,
Exactly.
there's a lot of trade-off between those two, and even still, like there's some deep learning models that are being developed now like the physics informed neural networks where
Mm-hmm.
you feed it a ton of data and it develops equations to explain that data. So it doesn't exactly tell you uh, how it's doing it to per se, but it's giving you an equation at the end that will and a like a evaluation for how good that equation does. So there's a
Mm-hmm.
lot of stuff that's being developed, and it's hard to keep up with,
Yeah.
especially when all the hot topics are ChatGPT and DeepSeek.
Mhm.
But I mean, that's part of the reason why we thought this was going to be such a good resource because it's like if you don't know about feature extraction, if you don't know about being able to use permutation to get feature importance from deep learning models, if you don't know about or even what like a transformer is,
Mhm.
then it's hard to delve into this and see the science and try to understand it, especially if you can't keep up with all the math.
Yeah, 100%. And I just want to add, because I know we mentioned before, like natural language processing. A lot of people think it's just some magical, like, oh my God, there's a brain somewhere that's understanding the language that I'm writing in my chatbot. And I'm using that as foreshadowing because we're going to talk about chatbots today, essentially. I did a project on the side for a completely unrelated task. Long story how I ended up there. It was to create a natural language processing code from scratch. And you realize once you actually think about the mathematics behind it, it's actually one, it's very intelligent. And two, it's very replicable. Like, for example, for chatbots, what you really need are things like tokenization, where you like break sentences down to paragraphs, or you do like stemming, where you reduce words to their like bases. So, like, for example, if I said the word running, running comes from the word run. So stemming would basically take anything that's running, runner, runs, and break it down to the root word. And then it does things like lemmatization, where it really tries to um get the basic dictionary form of a term. It's just all these really cool tricks that have to do with language. And then it turns this crazy paragraph of information you give it into something that's just numerical, more or less. And that's the kind of thought process and philosophy behind that, which is really, really, once you understand, it's kind of cool, to be honest. It's just like, I can do that on my own too. Maybe we'll all make GPT bots or whatever. But it's very, like, one of the things that we're trying to do here is demystify some of this stuff, because it may sound crazy at first, but once you kind of break it down to smaller pieces, you're like, wait, this was not too difficult. It's just a bunch of coding. There's a funny meme. Maybe I don't know how we can share that with people on this kind of podcast, but like it shows basically, like, a meme of like Freddy from Scooby Doo. He pulls off the hood of the bad guy, and it's like the bad guy has like the ghost mask, which is AI. He pulls off the hood. It just goes if then, if then, if then, like all those statements to really be like, this is all AI really is. And I
Yeah.
hope that's what we can really accomplish with all of our listeners when we start talking about this stuff, that it really is not something that's so crazy you'll never be able to like understand. It's really just really smart ways of dealing with real world problems, essentially.
Yeah, and especially with tokenization, like that's a really good example of how to get from one point to another in
Mhm.
multiple fields. Like for natural language processing, you can have that tokenization, which is you're turning like the word the into a number. So let's say it's one,
Mhm.
like the cat slept. So it's one, two, and three. You can do the same thing. I've done this previously. You can turn to try to convert this into some kind of biological relevance. Uh, you can turn codons in DNA into
Mm,
tokens. So
mm,
then, if because analyzing genomic sequences is huge, but if you can make that a third of the size
yeah,
just by tokenizing the codons, then
yeah,
you've simplified it and you've turned it into, and this is another thing that comes from just coding experience. Processing numbers is going to be easier than processing characters and
yeah,
strings and stuff like that. So
100%.
there's a lot of these things that have been developed over the years that it just takes experience to learn,
Yeah,
honestly.
and
Um, and learning that, seeing a kind of, or having someone explain kind of a basic use case, and then seeing how that's being applied in science or
mhm,
clinics or whatever. Like that's kind of the goal
yeah,
here.
yeah, yeah.
And uh,
And there's a cool benefit I wanted to point out too, because your work is of genetics, but the things like lemmatization and tokenization, that's a natural language processing application. But these toys can be really just reapplied in the most creative of ways. I forget if it was you or someone else. You were telling me how they basically took like a whole like one dimensional vector and just gave it to like a chatbot to basically try to like figure out the trends in the data. Was that you who did that? I feel like that was you.
I used a large language model recently to try to do regression tasks. Um,
Yeah.
and spoilers, it doesn't work great.
Okay. I was hoping it would be like some really cool, like, oh my God, I have discovered a cheat code.
Nope, it did miserable.
Okay,
it
well, my point
it
still stands though. The
it's
tool, the
cool. You can do stuff like that. And like
yeah,
on that note, I have used convolutional neural networks to analyze genomic sequences. So even
that's
though it's
awesome.
just a string of ATCGs, it's
Yeah.
not an image. Convolutional neural network isn't supposed to work with it, but you can turn those into what's another term if people want to make a list of terms to look up. One hot encoding. So it's
Mm,
where you turn a essentially what I did was I turned each letter into a one hot encoded sequence. So what does that mean?
mm,
It means that it has a a one in a certain spot. So A would be 1 0 0 0, and then T would be 0 1 0 0, then C 0 0 1 0, and then G obviously is 0 0 0 1.
yeah,
So by the time I did that, I had a two-dimensional vector of zeros and ones that I could then analyze with a convolutional neural network.
that's
So
awesome.
there's a lot of things that you can do. And once you
Yeah,
know how some of these tools work and how like what the rules are and how to bend them,
yeah.
it like the possibilities are limitless.
I would love for us to one day talk about one hot encoding because it's the greatest cheat code I've ever had to deal with with deep learning models in general. I feel so bad sometimes. I'm like, I feel like this audience using this, but it's just the standard that we tried to reuse it for the weirdest of things, and you just found another cool way to apply it.
Yeah, there's the amount of stuff that I learned that I can do by reading papers is
Yeah,
wild.
yeah.
Um,
It's awesome. Should we
Speaking
get?
of reading papers,
Yes. Okay. You want me to start talking about it, or do you want to introduce it?
you can introduce it.
Cool.
So just for context, we've decided for each episode we'll go back and forth and present some kind of news or article or research or whatever, and kind of talk through it, ask each other questions, and just kind
Yeah.
of explore the topic, I guess. And
Yeah.
this week it's Fahim. Go for it.
Yeah. So the article name, I don't think I wrote it down, but it was basically about chatbots and AI when it comes to chronic disease management and remote patient monitoring. So this article, it actually was basically like a major summary of some crazy paper that was done. The name of the paper, I have the paper name. It was called Revolutionizing Medicine: Chatbots as Catalysts for Improved Diagnosis, Treatment, and Patient Support. Are we able? I forget. Does YouTube allow us to put links in the description box? Like every year they change the rules for that.
Yeah,
But
where everywhere this goes, I'm going to provide links to what we talk about.
awesome,
So I
perfect.
meant to mention that. Yeah, so the papers we talk about and stuff like that. I'll make sure that the whatever we talk about is included in some way, shape, or form. Even if I have to read out the link character by character at the end of the episode, I will make it happen.
That'd be fun. I feel like no one was gonna actually write that down. That's awesome. So first, I'll give like a general summary what the paper is supposed to talk about, then actually go into the main paper itself. Because unfortunately, the thing I found is that when you try to really summarize this kind of big research, you miss some of the really cool tools that they actually worked on to really analyze and compare different kinds of modalities. Now, obviously, I won't go through the whole entire thing. Maybe if someone actually wants to, we can like give them my contact and I'll gladly talk about it for 2 hours. Because I spent 4 hours reading this. I was like, this is so cool. But essentially, what it's trying to do is posit that chatbots, there you go. They work as scalable, cost effective, and patient centric solutions to the different challenges that people will face in a clinical setting, whether it's provider shortage, whether it's care plan adherence for patients, or just communication efficiencies. So, like if you can't contact a patient or the patient is just not responsive, it tries to really help capture all those things. So, the way that the paper worked, first, they actually went across a whole bunch of databases like PubMed, Google Scholar, Web of Science. I think there were a couple of others. And they were just looking up key specific words related to chatbots in healthcare. Now, what they did was to really filter out whatever studies they found out. They tried to cut out as much articles which showed any kind of bias, sample size problems, or just unclear results. And they were really just trying to make sure that the tools that they had for this study were just randomized studies where you can get the best kind of data possible. So they ended up with 36 different high quality articles, which are independently reviewed to really make sure that they could gather and extract the most important information from these articles. And what they did is they separated all of the different chatbots that they found that were being used in a clinical setting that had these publications about them into five main categories. One was those kinds which are used for screening. So this is to really assess hereditary risks and really support early detection for patients. Then there was symptom detection, and this had a very high percentage of all the articles being written. Most of them were in the realm of symptom detection. So that's really applied across multiple disciplines: psychiatry, oncology, gen med, cardiology, you name it. And really, what it's trying to do is give this real time symptom tracking and triage mechanism for patients to give back to their providers. Then the third was really radio diagnostic. This is kind of a least popular. It was basically just supposed to support radiological image analysis. You can imagine this is not popular because how many people have access to their images in general? Not that cool. Well, not that it's cool, but it's not that accessible to an average patient population. Then they went on to talk about treatment planning. So this was very focused on oncology, gen med, and psychiatry, interestingly enough. And what it did was to really help physicians make evidence-based treatment decisions based on what their patients were saying to the chatbots. And then the fifth one was monitoring. So this was just for more of a long-term kind of medical practice to really improve patient engagement and treatment adherence. So this led to a whole bunch of different benefits to like the patient population in general, because when you have these very different kinds of disciplines of chatbots being used, it creates a different patient experience, and the clinical applicability for that becomes very vast too as a result of that. So, for example, when they had chatbots for really detecting symptoms very early on, like I said before, this is really just supposed to be able to give support for these early symptom kind of detections to really create personalized assessments, real time feedback, just basically just tailored guidance for the patient. And this made the healthcare more accessible for people, especially in underserved regions. It seemed like a lot of these models were actually kind of geared towards patients in like rural environments where they had no access to the physician. So it kind of worked as a way to kind of produce this report. Well, not just one of these, or multiple of these chatbots, but they give these kinds of reports to the physician where maybe the patient says 100 things and only 20 of them are actually meaningful. It distills that information, produces that report for the clinician, and then the clinician can have, for example, like a call with the patient afterward, kind of going that digital health kind of direction and really figure out how best to kind of treat them based on this information. Another one, I'm not going to go through all of them, obviously. I wrote a whole bunch of notes for every single one of these. I'm just talking about the ones that I were like, wow, this is really cool. Another one was really with the treatment itself, where it's giving very basic kind of therapy recommendations, help to monitor symptoms, and just made sure that patients were actually really adhering to their personalized care plans. And the idea here was that it engaged patients in the more chronic disease kind of world and made sure that they're actually truly treating their chronic disease effectively and also giving that information back to their provider. So this is just two of like the five different kinds of approaches. I'm not going to go through all of them, but the idea here is like what I was saying before, by using these bots to be more of an aid as opposed to like, just gathering information, but to really aid physicians, it gives this really scalable and cost effective means to really create those patient centric solutions. And if you have, like, for example, a shortage in nursing staff or shortage in physicians, there's a whole problem of how patients' experience is going to be when they go to the clinic itself. So by using these bots to really simplify that process, like imagine, for example, a patient is just writing down in the when he's booking his appointment or her appointment, they're writing down like what they're going through. The chatbot creates that kind of initial screening for the nurse who actually meets the patient to ask more targeted questions. And when they pass it off to the physician, they're able to get more time with the patient to actually provide an effective treatment plan. Like all of this works together to really integrate the AI to not replace a role, but to make sure the roles are able to be working at their fullest potential. Because a patient wants to see clinician as much as possible. They want to deal with nurse and like not just have to say, "Oh, when's my date of birth? Oh, what are you feeling right now?" All these like basic information that it's not as productive for the nurse's time or the physician's time or the patient's time. So by using all of these different chatbots, if we can come up with this really effective solution to combine them all together, we really reduce lots of the inefficiency in the healthcare system. So that's my spiel about this like 36-page paper I read.
Yeah, the article that we originally found this through was really interesting to me because it kind of specifically framed this as being, if I recall correctly, really good with like telehealth purposes. And I
Mm,
remember through, because even though we're in BME, uh, we had to do clinical rotations. And the one thing that I got from every area that I did a rotation in was if you want to solve all of our problems, just find a way to get patients to do the at-home care. And
yeah,
that's something that a lot of these bots kind of surprisingly do.
yeah,
It's not so much that they these people need someone at their homes to be like, take your
Mhm.
medicine right now. They just need something there that they can ask questions to
Yeah,
that will help demystify things and help keep them on track and
100%.
allow them to interact with. And that was so mind blowing for me because just the fact that they could have like this app that they could talk to or whatever
Yeah,
made sure that they were actually adhering to their care then.
yeah,
So, and then the fact that all that gets sent to, not obviously not all of it, there's going to be some kind of cleaning up of this so the doctor doesn't have to read 100 pages of the person asking, is aspirin okay? Uh, they
yeah,
just get like the gist of it, but it
yeah,
makes that process so much easier. It gives them an
yeah,
idea that the patient is actually like kind of engaged in their health and stuff.
yeah.
So like that
And
was
to
the really cool part about this to me.
yeah, and to add on to that, like imagine, I don't know if all of these chatbots have this feature now, but it's not really outside the realm of reason to make like a notification system. We're all using our phones. Even old people are using their phones. Hatta. And like what you'll find is that imagine you just get a notification like, take your meds right now, take your meds right now. Something as simple as that. Like, how often do we go through our days, even if we're like younger, relatively younger people? I don't know if we're young anymore. I think we've kind of crossed into the old people territory. But like, once you kind of reach like that more progression in your life, so many things come up. You just forget about your meds. Like I was supposed to take antibiotics like 2 weeks ago. Did not do that. I was just so like bad. I have like some of them still left. I'm like, what do I do now? Because I'm over the sickness. I didn't go through my whole treatment plan just because I forgot. It's simple as that. But if I have a notification, like we're all on our phones anyways. So just it's as simple as get the notification of like, oh yeah, take my pill. And it's with this kind of system, it's very much in the realm of reason to add that kind of functionality.
Yeah, and even on top of that, if you do miss one or miss a couple or whatever, being able to go to the bot and be like, "Is this okay? Do I
Yeah,
can I should I just stop?" And it can just give you an answer there on the spot. I mean, that's not something that's going to be super difficult. I know that a lot of these bots struggle with nuance specifically. So if there's it has to take a lot of considerations in to give someone an answer, then it'll struggle, and that's when a lot of the error rates start coming in for these kind of bots. But if it's
right.
something simple that a lot of patients just like need some kind of um I don't know, clarification on,
Mhm.
then like that's super easy. If that's all they need just to take some meds,
Yeah.
wicked. And it's not like this is another area of AI because I know a lot of people in the clinical world is like, is this going to take my job? Am I going to
Mm.
be without a job in the next 10 years because
Well,
I'm helping train this or whatever? This is
right.
something that's specifically for at home care, specifically to make sure people are adhering to what their physicians and everyone is telling them to do.
Mhm.
So it's not something that's maybe it's going to take the jobs of telehealth professionals. Uh, but if that's something that a lot of nurses and doctors were doing anyways, that was taking up time, this is going to free up that time and
Mhm.
allow
100%.
them to be better at their job, actually do their jobs and do the things they
Right.
care about in their jobs.
Right. Right. That's absolutely it. And another thing I kind of wanted to point to is that a lot of these bots, they're not like going to give you like they have something built in. I think it's called like humility or something like that, where basically just says, I don't know, when it's something that's too complex for its to actually give a reasonable kind of like prediction or guidance. And I think that's something that's really important too. Like we're not really we're like the whole point is to really reduce this kind of mistreatment that may sometimes occur. Um so I think giving that accessibility is 1,000 times more beneficial than just letting patients figure things out themselves.
Yeah, especially if they're relying on just like internet searches to try to find information and they end up
Exactly.
on thiswillfixyourhealth.org. Like you don't want them going to that website to get their health
Yeah.
advice. You want them to go to something that is implemented by a system, maybe Epic or something like that, that is going to
Yeah.
be tied into health records that could even at some point use that. Um, there's a lot of data privacy concerns and how you handle that, and that's something
Yeah.
that I think hospitals are very much uh, keen on addressing beforehand. I know I was listening to another podcast recently that was talking about the like the use case of some of these and how like, the thing you don't have to worry about is this thing taking your job. The thing you have to worry
Mhm.
about is like the data privacy and stuff that comes from this, and the
Right.
hospitals that are building teams to specifically help manage this because they're going to be implemented soon. Like this is one of the first times. This is another thing, just a little side tangent. This is one of the
Mhm.
first times research has created computational methods that were almost immediately implemented. Like, I know if anyone's
Mhm.
in the School of Medicine and had to take like 713 or whatever the ethics class was with
Yeah,
Dr.
yeah.
Norland, you heard this stat that it takes like 17 years for research to be implemented in actual care centers.
Mhm.
Now we're seeing Chat GPT come out the past few years, already being developed and trying to implement in these areas, and it's
Yeah.
just so fast paced that it's
Yeah.
kind of refreshing to see, but it's also obviously very scary because so much is happening so quick pretty
Yeah, yeah,
quick.
yeah. As long as people are not going to WebMD by themselves. So I think this is the right direction for us to be going in regardless.
Yeah, I do know people that are already going to ChatGPT
Yeah.
to be like, I'm having these symptoms, am I dying?
But at least it's more informed. Like
Yeah,
I
it's
think if you spend enough time on sites like WebMD, and WebMD is a very beautiful resource. Don't get me wrong, but it's like in the hands of a layman, you'll convince yourself you have like five different forms of cancer, and then realize that no, I just have a bad like a stomach ache or something like that. So
yeah, it's very easy to just spiral.
right.
And I honestly, I would much rather people be using WebMD or ChatGPT than getting their health advice off of TikTok. So,
That's
uh,
awesome.
but yeah, so uh, I think we can start winding down.
Yeah.
This is generally the kind of structure that we're thinking of. Obviously, this is our first episode, so there's going to be some rough spots. I'm going to iron out any audio issues or whatever. But in future episodes, if anyone has questions they want us to address, like I said, we want to have a segment where we answer those questions. We don't want to just talk at you and that's it.
Hmm.
So whenever this goes up in the description, I'll try to put a link to the article we talked about, the
Yeah.
paper that it's referencing, and then ways to contact us, send us questions,
Yeah.
stuff like that. I'm going to see if I can, how many platforms I can get this on.
Yeah.
Um, and go from there. But
Yeah. And for viewers, like if you have an article you want us to tackle, that would maybe fun to do as well. If it's some like giant 30,000 page nature publication, maybe not as reasonable for us, but if it's something that you're like, oh, I saw this on ainews.com or something like that, and I want you guys to talk about it, like that would be very fun just to
yeah,
kind of see what people want to hear about.
especially if it's something that you think is going to be uh, that's a highly contested or a hot topic that
Mm. Yeah.
people are worried about. Like, I
Yeah.
know the thing that happened recently with 23andMe going bankrupt. Like, what does that mean
Uh,
about the genetic data that's stored there and
yeah.
what can people do with it? Because I think that's the big thing people don't realize. They're like, all right, they have my genetic data, but what does that mean? What can people
Right.
even do with that? As someone
Yeah.
that works with AI on multiple omics data, I could talk about that. It's something that we can kind of demystify or at least inform you so you can make better decisions about things like this. So,
Exactly.
yeah, whatever people are worried about, especially whatever you're interested in, if you want to hear more about our research or whatever, yeah, feel free to let us know.
Yeah, sounds fantastic. Awesome. So I think we've covered everything we can do today. Thank you everyone for listening. If you got this far, that'd be pretty interesting to see. Please leave comments, like, share, subscribe. I feel like most basic YouTubers by saying that. Oh God.
Yeah,
But
we are
yeah.
turning into a content farm. We've got to start putting out clips. We've got to start making T-shirts. It's
Oh
going
my
to be a
God.
whole
Yeah.
thing.
Make a manga, reels, all that stuff. Make a Snapchat. Snapchat still used. I don't even know anymore. I lost track of all the social media platforms a long time ago.
Well, just be prepared for after we graduate. This is going to be our new job. I hope you weren't planning to get into any computational work. We're content creators now.
God forbid I go to get real employment.
But yeah, that's it. Thanks everyone for listening,
Yeah,
and we'll catch y'all next time.
take care.